It's been 5 months since the officials from the Tomah Health were with us to announce a number of cancellations and plans in light of COVID-19. Tomah Health Chief Nursing Officer Tracy Myhre and MSN RN at the hospital and Marketing and Public Relations Director Prise are here back with us to give an update how things have changed at the healthcare facility since this spring. Welcome back.
Yeah, good to see you. So you were here in March when this whole thing started to unravel, okay? And I think I went to one of the, was it the mental classes? It was something about Alzheimer's, early mental, something about, and then that was canceled. So update us. What's happened now 6 months later? Where are we at with programs?
Well, we've had a lot change since March. We are back open. Most of our services are open again. We have a 3-phase recovery plan, and we are in phase 2 of that.
Recovery from
recovery from where we had to kind of close everything down when COVID went.
Okay.
When we first,
so kind of like a phase 2 reopening?
Yes, yep. And so we have opened back up almost all of our services. We are doing full surgeries again, all of our elective surgeries. Really the only thing that we still have limited is we do have some limitations on our outpatient services, so rehab services. We've made some changes to our visitor policy, so we now allow visitors in our urgent care and our emergency department. We allow a visitor into our inpatient acute care, we call it. We also allow visitors 18 or over that can come and if a mom is coming in to deliver a baby, so they can have a person with them through their entire stay. And if somebody is coming in for an obstetrical ultrasound, so if a mom is coming in to have an ultrasound, we're allowing somebody to come with a visitor 18 or over to do that. We still are limiting visitors in our outpatient areas such as physical therapy, so we aren't allowing visitors there, and that really is to just limit the exposure in the hospital. And also we still are very cognizant of the amount of personal protective equipment that we're using.
So talking about personal protective, what is the mask policy, or do you want to update our viewers on?
Yes, well the short answer is yes, we do wear masks.
Yes, we do wear masks.
And I have my mask here with me. It's a staple for us, for every staff member. But if you're going to be a visitor or a patient to the hospital, to the Warren's Clinic, or to our palliative care or hospice facility, you will have to wear a mask when you enter. We do have masks available for those that may not have a mask with them. And we also have greeters at all the facilities too. So if you have questions, kind of wondering about what is happening, good a personal touch with that. And we also have lots of signage to keep everybody informed about all the different policies that are in place. But yes, you do have to wear a mask if you're coming to the facility.
When you go in, you get tested and ask a couple questions and that to see how you are. They get a little thing saying that you're passed there.
We do that, yes.
Is that called a screening?
Yes,
from what I'm hearing, because I had an eye doctor appointment recently, and it's screenings. I know that I'm very of a really good temperature lately.
Viewers are going to be really happy to hear what you're saying here, because I'm sure a lot of them have been disappointed because of all of the problems. And after a while, you go someplace and you figure, oh, don't even bother with the hospital. Everything is shut down. Nice to hear that this stuff is. Now, what's phase 3?
Phase 3 really would be when we would be open fully back up, and that, right now I think everyone is kind of in a phase 2 will be going on for a while until we get to a place where we kind of have a vaccine.
Are you seeing any trends up or down in terms of testing? We hear these numbers.
I was just going to ask her, what is COVID testing?
Ask the question.
Are you doing COVID testing?
We are testing, but we are only testing at the hospital in our urgent care and our emergency department patients who have symptoms. So we are not currently testing asymptomatic or people who don't have symptoms. We do, if people are wanting that type of testing, if they check with the public health department, there are many times where they have some drive-through testing that they may set up, and that is offered to other places. Currently, we're not able to offer that at the hospital.
Okay. And the last minute or so classes, Nick, we should.
Last time we were here 5 months ago, everything was pretty much shut down. Now, some of the classes have come back, but virtually. So that's really what we're offering now. The other thing that we're trying to get out to the word, you may have seen a mailing that came to your mailing into your post box about some of the safe conditions and what we're doing at the hospital and our clinic. It's really a way for us to get the word out and let people know. Some of the events, like for the bloodborne pathogen training for the Tomah School District, was done this week virtually. So, we're finding more and more opportunities where we can do things online to keep that safe distance. And I have a hunch that we're going to see more things that are going to be done virtually, but it's kind of the way the world is now. And I think people are accepting that. We're just telling people to stay in touch with our social media or go to our website at tomahhealth.org, and you'll be able to keep up to date on different events and activities.
Great.